So I'm here in Kenya, in Nairobi, and I just saw a couple of very interesting health projects, and I learned a lot from them. Since the 1960s, when IDA first got involved, until now, life expectancy has nearly doubled. It's a significant improvement. There were only, I believe, 800 health facilities in the whole country. Now there are 14,000. In recent years, they introduced digitization, the community workers, and this health insurance, all of which is a pretty amazing feat.
In Riruta, we are so privileged to have very cooperative nurses. As you've gone around, and especially our maternity ward, you see that the services offered there, the midwives are happy, they are up to task, and they have all the skills that they require to offer the services to the mothers. Our maternity is the youngest in Nairobi County, having started last year around February, and currently we are running deliveries between 100 and 150 in a month.
January to December of last year, the deliveries have been 849, nearly 350 deliveries with no maternal death and only one neonatal death. I think there's a feeling as a doctor when a patient comes with a problem and you solve it. There's that feeling I can't explain.
Ni service hapa nimeenjoy, imekuwa mzuri. Niliingia kama nini zangu ziko chini, but ile speed walinichukulia ni kuniatendia, so ilifanya at least nikapata mtoto haraka, walinishughulikia vizuri, nikafeel vizuri. Yeah.
We feel happy when we see the mother holding the newborn, and that is our happiness as midwives, to have a healthy baby and a healthy mother.
You know, I really saw IDA money being used very productively, and most of all by people who are really committed, who really want to help the poor, and people who are enthusiastic and dynamic. So this combination of IDA funds and the local people trying to help others, that I saw to be a fantastic combination.
We have 2 rooms for critical care. This serves as a HDU, high dependency unit, where we step down babies after they've been ventilated or after they've had special procedures. We are able to do intravenous fluids. We are able to do breathing support using the CPAP device. So the biggest reason for admitting them is usually breathing. They need breathing support, but they also need warmth, and they need medication to treat infections. We have an adolescent pregnancy rate of about 15–16%, and many of them are at high risk of getting premature babies. So it also spirals into other aspects like community care. That's why we need the community strategy, because even when we discharge the babies, they still need care at home, support, education, and economic empowerment for these mothers.
IDA has been able to help these medical facilities at a time of crisis. And what I mean by this is, in this newborn ward, we saw the oxygen supply facilities. Now that was a critical function during the COVID years that IDA helped install in these facilities.
Well, I've been in this unit for the past 4 years, yes, and it has its ups and downs. Some don't make it, some, quite a good number make it. Yeah, so it has those mixed feelings for us, the caregivers. Yeah.
Since I came here, my baby was too tiny, and you can see by now it's a bit big. I've enjoyed to be here because my baby has been well maintained and has been well kept.
Seeing a mother go home with their baby in their hands, healthy, I think that's the best bit. It's the best bit, because some of them come here in a very critical condition. They stay in the NICU for a very long time, get to NHDU, still stay there for a long time, go to the rooms and relapse, back to NICU. So when you get to see such a mother go home with their child in their hands healthy, it's so rewarding. That's the most rewarding bit of my career, of this profession.
IDA is about the future. Because it's about sustainability, it's about the environment, it's about economic growth and raising people's income levels. So we really need to think about the next generation and the generation after that to be able to help countries when help is needed the most. I think it's something that IDA does, and I'm very proud of that.